I'll show you EKG rhythms. Now this is a patient monitor which I went on this right now for this video, and this is the patient monitor EKGs which I will be discussing. Now this is sinus tachycardia with 150 BPM. Sinus tachycardia triggers a flight or fight response, means that it increases this risk of sinus tachycardia due to anger, due to stress, or due to fear. And this is how it causes sinus tachycardia. Next, we will move on to the next rhythm. The next rhythm is sinus rhythm. This is normal sinus rhythm, the normal heart rate, and the normal experience of our hearts every day and every week and every year. This is characterized by normal beating patterns, and now this is the normal BPM which we are using to quantify which EKG rhythm is our heart is beating. And this is normal sinus rhythm. Now this rhythm is the most standard in even children, even if the heart rate is up in sinus tachycardia. But when they grow up, it slows down and it beats into sinus rhythm. Children's heart rate can be a bit faster, the rate, and newborns can be extremely fast. This is very normal about their development, because their hearts are actually growing. That's why they need to be extremely fast, similar to sinus supraventricular tachycardia, SVT. And that's what newborns experience, and even toddlers, even they're not having problems. Because the reason why, because it's a normal part of their heart rhythm. Now, when a person reaches age, I think that is age 5. When the person reaches that, the rhythm slowly, permanently gets into normal sinus rhythm. And this is the rhythm that we all experience today. And I am young, and you guys are young. We are all experiencing this rhythm. And we are going to move on to the next rhythm, which is ST elevation infarction. Now, ST elevation is an ischemic heart disease called myocardial infarction, which makes the people's like the person's heart to burn. Now, in the symptoms, the chest begins to develop extreme pain, and the heart begins to burn internally, like burning a fire in the fireplace. The same thing happens to the heart, even if not burning, real burning. And this is a EKG characterized by MI. Now MI stands for myoinfarction, and this symptoms requires a patient to do immediate action. If a patient have this, if the patient sees this rhythm on their heart and the patient is panicking, then they should be sent to treatment immediately, and the patient is sent to the surgical operation theatre for a heart surgery. Then the patient is sent into a cath lab immediately. Then in the cath lab, the doctors search on the patient's heart, and then I think that it is going to be undergo a heart transplant with a new heart. But this is not sufficient to the patient's heart, because it can be repaired easily with cold ice pack. Now, after the treatment is done, the patient should rest for at least, I think that is about maximum 4 days. That maximum of days the patient should rest, and the patient should apply an ice pack on their heart. And the patient should not take a shower, because I think that their rest is going to be disruptive as the pain is going to be increased. The patient should not take a shower, and the patient should take the patient should take a beta blocker, and the patient should eat them once a day. Why? Because beta blocker only allow one dose in only single one of day. If they're taking too much, it might cause the body to do something wrong. They should consult a doctor for medical checks and even for emergency and beta blockers with this EKG rhythm they're experiencing. Doctors have also noted and reported that patients with no myocardial extremeless syndrome is called a patient with no syndromes. And when the patient is on a stretcher and the doctor is checking their heart, and the defibrillator monitors it is currently showing that the patient has a silent MI, and that means there's no kind of issues at all. Everything is good, but the patient is still experiencing pain. Even then, that the patient still needs to have urgent medical attention for the treatment to work, and even beta blockers apply in that scenario. And that's what ST elevation causes to the patient's heart. We're moving on to the next room, which is ST depression. ST depression is a EKG rhythm. Now, ST depression is an EKG with turned out segments waves, and ST depression causes I don't know, I'll just search on Google and I'll show you what is that. There you go, it is myocardial ischemia and ventricular hypertrophy and electrolyte imbalances like hypokalemia. This rhythm causes hypokalemia. Why I keep losing the meaning. ST depression is caused by hypokalemia and myocardial ischemic heart disease, which even causes ST elevation. Now, this rhythm should be treated as quickly as possible if the patient was seen in this rhythm. Now, this rhythm is the most critical factor for the heart, and this rhythm should be treated immediately within the doctor, which is treating the patient. We're moving to the next heart rhythm, SVT, supraventricular tachycardia. Supraventricular tachycardia is a rhythm which has an extremely fast heart rate with 180 BPM. You can see here 180. Now, this EKG's rhythm only has one T wave and one QRS's beats per minute, with no P waves or any other waves like the ST segment. Only the T waves are visible. The reason why? Because this waveform acts like a micro T-wave system EKG series, then that means it lacks a P wave, and the next ST segment contributed and built into it. It lacks them all. Only T wave is not absent, and the QRSs are also not absent. And I'll search of what is SVT. I'll search it down, and the SVT causes from heart abnormal activity due to extra electrical pathway or circuit. These can prevent presence from birth or develop later. Of suddenly fast heart rate, episodes can grow, and they can also include stress, caffeine, alcohol, and certain medication, etc. SVT also happens if the person is feeling much more angrier and is not getting out of stress, which a person should be doing, or too much of caffeinating and non-stop eating unnecessary medications, which causes this EKG rhythm and the heart rate to go extremely fast, even if the person's fast is a bit slow. Even that, the heart rate still goes fast for the heart to pump blood in this dangerous rhythm. We are moving on. This can also happen after birth if the mother has incorrectly produced a birth. This rhythm can also happen as well if that happens. We're moving on to the next rhythm. We'll move on to the atrial flutter. The atrial flutter is like a heart rhythm. Now this rhythm is kind of like wavy lines, etc. But these like a straight line and a P wave and a T wave. Only this wavy fin, shark's fin like lines. And this EKG rhythm happens from I'll search it, a flutter. Then it caused by a short circuit in the heart's electrical system, leading to rapid but organized contractions of the upper heart chamber's atria. Heart valve disease, coronary artery disease, high blood pressure. This can also happen from high blood pressure and incorrect coronary systems on the heart. And to be treated, the patient should be cardioverted, but is not as expected as it would if in VF or VT or even atrial fibrillation, I think. But if that happened, if cardioversion, if that was possible in this EKG rhythm, the patient's heart could stop, and the doctors need to do a cardioversion, then the patient can be discharged. And we'll control the vital signs, change the EKG rhythm. I'll change the ventricular tachycardia with pulse. So monitor. Now this is the EKG rhythm, ventricular tachycardia, VT. Now this is beating up at 180 BPM, and this rhythm is a form of cardiac arrest. This rhythm also happens during cardiac arrest, along with asystole, a final series of cardiac arrest, and VFib, or final VFib, whichever, on cardiac arrest. The heart rate needs to pump as fast as the heart can, and the heart's internal components like the atria, etc., quivers a lot faster. And this EKG rhythm should be defibrillated, or if cardioversion was available, but in most cases it was not. But I think that it should be defibrillated almost immediately before the patient could be dead. And give mouth to mouth if mouth to mouth was allowed. But I think that it will be allowed, but only in VFib scenarios or cardiac arrest. Give CPR with about counting up to 30 and standing clear and pushing the charge button, reaching the low to high pitch of the defibrillating jaw's charging sound, then immediately pressing the charging button and not waiting until the disarm is shown. But we should analyze the rhythm if we need to charge and shock the patient. That is the most important thing we should do to analyze, which is analyzing the defibrillator, then charging, then shocking the EKG rhythm, then give a CPR of up to counting up to 30 CPR rates, and when the cardioversion or even the defibrillation was successful, the patient will begin to go back into normal sinus rhythm. I'll display the monitor. And ventricular fibrillation. This is ventricular fibrillation. Now this is a form of cardiac arrest, and this is the widely considered the cause of cardiac arrest on the patient's heart. And this EKG rhythm results in a heart of beating, but the heart's internal components are disorganized and quivers disorganizedly, and the heart is beating as much faster, and the heart is needing attention of defibrillating and shocking, and even giving basic CPR and even advanced life support, ACLS and AED functions, or a basic defib with paddles if that was available. But I think that AED is recommended, and this EKG rhythm is caused by cardiac arrest. Now, what happens during cardiac arrest? Imagine this: a person playing football, and if a person was still playing football, but suddenly the person falls down, then falling down to the ground with the heart rate stopped. Once it's stopped, it beats into ventricular fibrillation, and the football player is in cardiac arrest. And this is the most highly common example of how cardiac arrest begins. And that starts with a football player, or even about a story of an officer working on his computer. But the officer in its office feels pain in his chest, the person shivers, shaking, the coffee spills to the ground, and the person stands up, and then the person tries to calm himself down, but the person falls down onto the floor. Then the servant gets extremely shocked, calling emergency numbers like 999 or other emergency numbers like 112, depending on the country you live, or the person or the story which country it is based on. Then, when they call the numbers, they ask for immediate and extremely urgent emergency help. The paramedics arrive in the office looking for the patient. They found the patient. Then they assess the patient onto a stretcher. But before that, they perform CPR. Then they do mouth to mouth. Then after that, they bring a stretcher to the ambulance. They apply oxygen mask. Then they turn on the siren of the ambulance. Then they reach the patient to the hospital. Then they perform CPR, and they try their best to make sure that the patient is shocked by the defibrillator. First, they attach the pads, or the older pads method, which is the older one, but the pads are the newer one in this world. Then they charge the defibrillator. First they analyze, then they charge, then they shock. But before, in the middle, they select, in the first layer, the very first layer, they select how much joules we need to have. I think that they will need to have 360 joules of defibrillator. Then, when they select that, they charge the EKG rhythm. Once that is done, they will analyze. Then they will can shock the rhythm. Then the patient is back to normal sinus rhythm. Next, we'll change the EKG rhythm and I will select pulses ventricular tachycardia. Now this rhythm is pulseless ventricular tachycardia, even with the rhythm highly visible. Now this rhythm also has the same causes of the pulse VT. You can see the SpO2 is very low with few waves, EtCO2, ABP, SpO2. These are showing few lines, wave graphs, few ups and downs of waves, but in a very flat mode. But the EKG is only one available to show the wide and everything else. And pulse ventricular tachycardia means the patient is currently dead, that is unconscious, and the paramedic are still performing CPR onto the patient, and they're still charging and shocking the patient, but nothing worked. The patient is still dead. That is unconscious. The patient will be defibrillated with more advanced methods. Now, if that didn't work, the patient's heart will need to be transplanted, but I mean that transplant is not needed. The patient will be transferred to the OT operation theatre. When in the OT theatre, the patient's heart will be taken out. Then the surgeon will check the patient's heart for any known diseases or problems. When they found it, it shows the results that it caused pulseless VT. Then they charge the patient. But that is not the case. The only case is they charge the patient and they shock the patient many times as they can in order to save the patient's life. And if the patient was then alive, but they still need to give more CPR to the even a bit showing like a live patient. Even CPR needed for that, because the patient is not alive yet, it's still a very little bit alive in that scenario. And that is still pulsive ventricular tachycardia, and that means that the patient is not yet alive, and the patient is not breathing, and the patient's pulsive ventricular tachycardia is showing on the monitor. First they analyze the defibrillator, then they charge, then they shock the rhythm, then it's like 360 joules. Another option, if the current methods are insufficient, like performing CPR on the patient is not alive. And that is how our EKG rhythm video works. Now this video is for you all, which you use to comment in my videos, because I left YouTube about 1 year ago, but before that you used to comment on my videos more often. And please remember to comment on my videos, and please rejoin my channel, and thank you for watching. Like and subscribe to my channel and hit the bell icon, and don't miss out a video from us. Goodbye. And keep researching the causes and other issues of VFib, VT, AFIB, but the normal sinus rhythm also. But there's no need to search about that, because that is normal rhythm, that is fine. But you should only search about what happens when the patient experiences VFib, VT, ST elevation, etc. Goodbye. Keep up with your research, and remember to see my next video.